Welcome to the special report on COVID-19 from the Washington Post. I'm Libby Casey, the politics anchor for Politics and Accountability, and I'm joining you today from the Washington Post newsroom, which is a rare privilege these days. My colleagues and guests will still be rejoining me remotely, however, as we continue to practice safe social distancing. Here are the latest headlines that we're watching. The U.S. death toll for the novel coronavirus has now topped 80,000. That's known cases. Dr. Anthony Fauci, the country's top infectious disease expert, pleaded for caution at a hearing on Capitol Hill today, and he warned that opening the country too quickly could lead to needless suffering and death. And the House of Representatives will meet Friday on another stimulus relief bill. Democrats want to see a $3 trillion package for state and local governments and health systems and more stimulus checks. Republicans so far are dismissive of the efforts, but we'll see where it will all go. Joining me now for more, Yasmin Abutaleb, health policy reporter, and Amber Phillips, reporter for The Fix. It's so good to see both of you. Make sure you're unmuted, and we'll dive right in, Yasmin, with today's hearing. The big news was that Anthony Fauci and other top U.S. health officials testified before a Senate committee. And this was the first time that senators were able to ask them questions since President Trump declared this state of national emergency a couple of months ago. What were the big takeaways from today's hearing?
The big takeaways were that all the health officials warned that, without proper preparations and safeguards, the country was not ready to reopen safely without risking new waves of outbreaks or a resurgence, in the late summer or in the fall. Dr. Fauci talked a lot about, the fact that states need to follow the federal guidelines for reopening and not to, reopen too quickly or rush into it, or else they would set themselves back and would actually impede the economic recovery as well, because they would have new outbreaks that would be very hard to contain. He set very realistic expectations about when to expect a vaccine and, a more effective drug for coronavirus. And, Senator Lamar Alexander, the chairman of the committee, at one point asked, if you were talking to a chancellor or a high school principal who wants to reopen in the fall, what would you say about the availability of vaccines and therapeutics? And he would say it's just not realistic to expect those to be ready in the fall for when students are returning to school, whether it's college or high school. Dr. Redfield, the CDC director, talked about the need to increase contact tracing 5 to 10-fold by the fall. So it was just, a hearing that was almost entirely focused on the sort of health measures that are needed to safely reopen. I think the takeaway that was pretty clear was that life is not going back to normal anytime soon, and that there are a lot of risks that remain, even as, the president and others want states to reopen, want to say the economy is going to come roaring back. But I think the health officials gave a pretty sober message about, how long it will take to get there and how we need to do so very methodically and carefully, or else we're going to set ourselves backwards.
Amber, what did you learn from the senators' questions? Because, the senators on this committee, the Health, Education, Labor, and Pensions Committee, the HELP Committee, really represent all parts of the country, right? And a lot of political stripes as well, from presidential candidates that we saw, of course, make so much news this past year, Elizabeth Warren, Bernie Sanders, moderate Republicans like Mitt Romney, Lamar Alexander could arguably be called a moderate Republican these days, to the real, flamethrowers on the Republican side of the aisle, Rand Paul. So what did you learn from their line of questioning and what they're grappling with?
I think overall that there is a general consensus that testing is not where it needs to be. And same with contact tracing as well. You had Lisa Murkowski from Alaska saying, what should someone do when they test positive? And then they knew they were on a plane and they saw their grandma. What do they do? Tell me, federal government. You had Mitt Romney say that testing is not something that we should celebrate right now, the amount of testing we're at. I mean, the goal is to increase it by like tenfold in order to be able to get in a place where, a university could open up and students could all get tested on that same day. And so if you're stay in this campus, everyone might be okay. Like that might not happen till the fall is what the testing czar said today. And then, you did have some headlines, including one I just wrote about from Senator Rand Paul, who could be described as a flamethrower, like you said, Libby, who was skeptical of Fauci, who gave voice to the skeptics about his advice that shutting down the nation is the right thing to do right now. He and Bill Cassidy of Louisiana argued, what do you do if we get to the fall and you can't send kids back to school for a couple of months or another year? Is it really worth, in a rural state like Kentucky, having them lose, that amount of education in person at least? But overall, the consensus from this Republican-led committee and Republicans in it was that they were concerned we're just not where we need to be to reopen the country right now in terms of testing and contact tracing.
Yasmeen, why hear from these leading medical professionals now? Dr. Fauci was called to testify before a House committee. The White House wouldn't let that happen, but this did move forward today. Why go before this committee at this time?
Well, the Senate is controlled by Republicans, so I think that probably played a large role. The HELP committee, the Health, Education, Labor, and Pensions committee, the House, I think, could tend to be a little bit more politicized. People looking for sound bites, that type of thing. There was a little bit of that today, but it was, largely focused on what health countermeasures are needed to safely reopen and how to do it. And there are still a lot of questions about how states should be moving forward. There isn't very detailed federal guidance. Both Republican and Democratic senators pointed that out today. And I think just a lot of people are looking for answers about how you reopen, what's safe, what's not safe, when do you risk, another outbreak where, you sort of undo any progress you might be trying to do on the economic front. So I think there were genuinely a lot of questions. Senator Chris Murphy at one point basically pleaded with the CDC director and the other health officials to put out more detailed federal guidance about how states should reopen. He said the guidelines that existed now were criminally vague, and that his state, Connecticut, and others just did not know how to move forward, even though they had reopening dates that were, just a few days away.
Yeah, let's talk more about Senator Murphy, Yasmeen. He really tried to pin Dr. Redfield down on when states would get more guidance, more details about just what to do if there was a subsequent, surge in cases, or, if this happens, then you take this course. Dr. Redfield was unable to give him a timeline. Why?
I think he honestly doesn't know. Dr. Redfield said that the guidance had gone through the CDC and would make its way to the White House eventually, but there were several outlets that reported last week that the White House rejected the more detailed CDC guidance because they thought it was overly prescriptive. There was a big push by the White House and by federal officials to really keep this at the state level, to make this a state responsibility to reopen and how to reopen and when to do that, and to not set metrics or very prescriptive federal guidelines. And part of that is to shield themselves from responsibility if something goes wrong, if a state or a city prematurely reopens.
We heard Senator Sanders asking about a second wave and referring to like the 1918 flu epidemic, Amber, and asking, for sort of more about next steps. What were your thoughts about whether senators were able to get information from these health leaders about what they're thinking might happen in the fall, what they're thinking might happen a year out from now?
Well, I think Fauci was pretty clear, as Yasmeen outlined at the top, that he's worried that there will be outbreaks, not just because of the colder weather and the resurgence, coronavirus for natural reasons, but because people could open sooner, than the federal government would like them to do. That states and localities haven't shown that cases have gone down for 14 days before they start, letting hair salons and tattoo parlors, for example, in Georgia, reopen. So, what I heard from Fauci and some of the other health experts say, but most vocally Fauci, was they were concerned that those two things could collide, lead to issues in the fall. As far as what the government's doing about that, the answer was always, came down to, we're working on it. We are trying to ramp up testing. President Trump had a big press conference in the Rose Garden last night to announce that they're getting there. They're working on getting hundreds of thousands, if not millions, tests a day. The White House's testing czar said that he hoped that there would be 40 to 50 million tests by November. They're trying to figure out how you build up an army of contact tracers. They're trying to partner with states to see what they need, when they need it in terms of resources. But I think the large part of this is that the federal government, these officials feel a little hamstrung because President Trump has consistently said this is up to states to figure out for themselves. how to get the equipment they need, how to get the testing they need. The federal government will help if needed, but it's up to the states. So like, there wasn't a clear answer on exactly on what you do if you get to November and all of a sudden it's really bad again. And officials warned that could be the case.
And that Chris Murphy exchange sort of highlights that, because Dr. Redfield, the CDC director, was like, well, you guys can call us and we'll help talk you through it. You can call us with questions you have. But what Senator Murphy was asking for was, no, give us these, guidelines and steps and more details, so every state can figure out just how they should proceed. Amber, I found this exchange with Senator Tammy Baldwin very interesting, because she was asking a question that's on many people's minds. Can the model that the White House is now trying to engage in, regular testing for anyone who comes in contact with the president, now people wearing masks, some social distancing, at least among like the press corps, for example, at press briefings, can that be done at other places? Can that be a model for the rest of the country? If it's good enough for the president, can it be good enough for everyone else? And at the same time, you've reported that Kevin Hassett was on Sunday saying that the White House is a scary place to work.
Right, exactly. I think what Tammy Baldwin was trying to get at is that something our colleague, our White House Washington Post bureau chief, Phil Rucker, got at very clearly when he asked President Trump about this last night, which is, listen, if the White House is one of the most secure places in the nation right now because of all that frequent and rapid testing, it takes minutes, not days, to get your results back, is you underscore what they're doing, Libby. It's the most secure place right now, and yet you still had coronavirus infiltrate it. You still had coronavirus infiltrate the Senate, even though they have these huge cavernous halls to hold their meetings in. Senators are doing their best to work remotely and wear a mask as much as they can. It still came to the Senate pretty quickly. Lamar Alexander, the chairperson of this committee, had to hold the hearing from his home in Tennessee after he came back to Capitol Hill and a staffer tested positive for the virus, basically almost immediately. I don't know, again, I keep saying this, but I don't know that there was a clear answer on how workplaces handle that, because there's no like cavernous hall for a nail salon. The CDC guidance for how to handle that has been shelved, that the Washington Post has gotten a hold of, a draft of it, has said like, just cancel break rooms, don't allow public restrooms. But I think what we saw this week is that even with the best precautions possible, it's still really difficult to prevent coronavirus from coming in.
All right, Amber Phillips, reporter for The Fix, thank you so much for joining us and for sharing your coverage of the hearing today. Yasmin, there were a lot of questions about a vaccine. And so I'd love to hear you talk more, since you've been reporting on this so extensively, about the conversation around a vaccine, and if you learned anything new today as Dr. Fauci and others testified.
I think the interesting thing was that Dr. Fauci was trying to set very realistic expectations about what to expect from a vaccine and when to expect it. There are sometimes the vaccine is sort of a metric for when things can start to return to normal, when people can start to feel safe living with the virus sort of, being in the US, but knowing that there is some way to prevent it or to treat it. Dr. Fauci didn't want to make any sort of false promises or assurances about when a vaccine would be available, or even guarantee that there will be one in a year. At one point he said, there is no guarantee that a vaccine will be effective. Sometimes it can actually make things work. They're trying to work on a historic timeline to develop this vaccine. The fastest the vaccine has ever been developed before this is 4 years. They're trying to do this in, just over a year. But at one point, Senator Romney asked, is it a long shot to expect that we will have a vaccine within a year or two? And Dr. Fauci said, no, it's not a long shot at all. I think it's more likely than not that we will. But I think he just didn't want to promise that, by April, we will have a vaccine that's widely available and everything will be fine, because that is by no means an assurance.
Our colleague Rhonda Colvin now joins us, who was on Capitol Hill today covering the hearing. Rhonda, I want to hear all about your experience today and also how you've been doing your reporting on Capitol Hill and members of Congress. But first, we've been talking about some of the highlights and takeaways from today's hearing. My question for you is, do we have a sense of where senators go from here? We're seeing the House Democrats propose yet another big spending package, but do we have a sense of how Congress might move forward with the information they gained today?
I don't think that we do. And I think we really got a sense of that at the end when Lamar Alexander said this was a good hearing and I foresee, doing more of these. I think the Senate and also the House, they are figuring things out as they go, just like the rest of us. There were probably things mentioned in the hearing that might spur smaller hearings in the future, specifically the talk about nursing homes. That was brought up a couple times by a few senators about what are we going to do with nursing homes. I could see another committee having a hearing just on that. Education, I could see a hearing just on that. So I think it's really a day-to-day process with the Hill and with lawmakers trying to figure out how do we address needs and what do we do with the constraints they're also working under. The House has not come back yet. They are planning to return possibly Friday to take up a vote on that aid package you just mentioned. But things are still definitely not back to normal over there.
You know, the title of this hearing, Yasmin, was Safely Getting Back to Work and Back to School. And, you know, it just the contrast between the title of the hearing and the visuals of seeing senators and witnesses being brought in remotely sort of was a reality check on just where we're at. You know, Yasmin, what were your thoughts on how much the health professionals were encouraging or discouraging moving forward on reopening?
You know, I thought they struck a pretty different tone than what we've heard from the president and from some of his political advisors about reopening. They took a very measured tone. You know, they all were testifying remotely, as was Lamar Alexander, because they've all come into contact with confirmed infections in the last few days and, you know, are taking some measure of self-isolation at home. I think that says a lot that, you know, for this hearing that was about safely returning to work, a lot of the key members of this hearing could not safely be in their workplaces to conduct the hearing. And I think, you know, the health officials were basically saying, we're not exactly, they didn't say it directly, but I think we're saying we're not exactly where we need to be to safely reopen. We're not all going to be going to restaurants or going back to school or going back to work anytime soon. These are all the measures that we need to have in place before we can really safely do that. You know, Brett Giroir, the testing czar for the administration, said they hope to have 40 to 50 million tests by September. That's still 4 months away. And even that amounts to fewer than 2 million tests a day. Most experts say you need to conduct 2 to 3 million to safely send people back to work so that you can do, you know, essentially what the White House and what the Senate have been able to do. You quickly identify people who test positive and you make sure everyone else isolates at home so you don't have outbreaks. You know, if you don't have regular tests in workplace, you can't do that. You'll have these outbreaks in workplaces that we've seen at like meat packing plants or retail stores where people don't have access to regular tests. And that just risks another huge wave or outbreak of the virus. Dr. Redfield mentioned needing a lot more contact tracing. We've seen no sort of national contact tracing plan from the administration. It's been a huge hole for weeks, but there's still really no plan about how that's going to ramp up or how you're going to have 5 to 10 times the number of contact tracers in place by the fall. So I think it was a very measured tone. They didn't make any false assurances about therapeutics or a vaccine that will be available, and, you know, warn that the fall could actually be more difficult because it'll coincide with the flu.
Rhonda, you've been managing to interview members of Congress, but how have you been talking to them? How are you conducting interviews? What is this remote situation like?
You know, a lot of it is how everyone's handling their business now, and it's Zoom. I remember one of the first weeks when all of this started to hit, I contacted a few sources saying, hey, well, you know, Senator or Congress person XYZ talked to me over Zoom. And at first it was like, probably not. And then a week later it was like, wait a minute, can we do a Zoom with you? And that became the, you know, the natural way of doing things. And in fact, that's the safer way, a lot of their staff say, of doing things right now. They don't necessarily want to book interviews one-on-one or face-to-face. They'd rather do it remotely through Zoom. So it seems since the progression of all of this, they've become more comfortable with doing remote interviewing. And, you know, honestly, one of the things that I found is you don't necessarily have sort of the you know, the buttoned up sense of talking to a lawmaker on the Hill next to the pretty columns in Russell. When it's Zoom, you know, you get a lot of very interesting and very personal feedback from them. I've been talking to members about what exactly is happening in your district, and a lot of them have very personal stories of how this is hitting them on the ground. So if anything, you are seeing some very genuine interviews come out of this situation where we're all, you know, saying we're all in the same boat.
Yasmin, you were talking about contact tracing, and Senator Murkowski, who is from one of those states that has sort of a very unique and interesting situation, because like Hawaii, it is distanced geographically from other parts of the United States. And she was talking about this question of contact tracing and just how it could be mobilized, right? Do you get AmeriCorps involved? Do you get the Peace Corps involved? Who do you get to sort of, come in and provide these people who can be contact tracers, who can be trained to do that job? Is this something that states are just having to figure out one by one on their own?
Right now, that is how they're figuring it out. They're either partnering with, sort of regionally states that are close to each other. Massachusetts has already mounted a pretty large contact tracing course. Other states have done the same. Experts I've spoken to have said, you actually have a pretty ripe opportunity to get a bunch of contact tracers. You have millions of Americans who are out of work, who need work. Train them to become contact tracers. The U.S. needs, hundreds of thousands of them in the next few months. Train those people who are out of work to become contact tracers. It basically involves calling people, figuring out who their contacts were, who they came in contact with, what stores or, public places they may have gone to. You can train people to do that. And that, experts have said this is actually a great opportunity to help people who are out of work find jobs and also perform a sort of vital service that the country really needs.
Yeah, she talked about Cordova, Alaska. It's getting ready to open its Copper River salmon fishery. And she said they were able to test people as they were coming in. They figured out one worker tested positive, so they were able to trace and figure that out and deal with it. But that's talking about being able to track people and test people in a way that we have not seen the administration able to ramp up. So how did the testing czar deal with these questions when senators were asking pointedly about accountability and where the test numbers are?
He talked a lot about how far the U.S. has come in terms of testing capacity and where he thinks they'll be in the coming months. He was pressed a number of times, both by Senator Romney and by some Democratic senators, about would the administration commit to metrics that it thought it needed and trying to meet those metrics. And he wouldn't really commit to that. He'd say what he thought the country was capable of doing and where he thought it would be, but would not sort of set out metrics of where he thought we needed to be in July or in September or November. And I think that's probably pretty intentional. You don't want to set a metric that you're then not able to meet. And he just kept saying, we need to follow the data and make this an evidence-based approach and then decide what we need. But this question with testing has sort of plagued the U.S. response from the beginning. The U.S. has made a ton of improvements in testing, and you saw the president and Dr. Jawad and other officials, trying to celebrate that in the Rose Garden yesterday. But you saw Senator Romney, really go after them for that. He said, I don't expect an admiral, Dr. Jawad's an admiral, to politicize numbers and to be celebrating testing. I don't think the U.S. testing is anything to celebrate whatsoever. He didn't mince words there. And he said, you keep comparing yourselves to South Korea, saying you've surpassed South Korea in per capita testing. But the thing you're leaving out is that South Korea had pretty impressive testing capacity right at the beginning of their outbreak. And they've had 256 or 258 deaths total, basically saying, it's really not fair to say the U.S. has more testing capacity than South Korea right now, because the U.S. has always sort of been behind the curve in terms of testing capacity. So even though they've made improvements, and that obviously should be acknowledged, it's always several weeks behind what's needed.
We talked a little bit about Rand Paul, but I want to talk more about him. Rhonda, he brought up kids in schools and the need to get children back to school. And he was a bit dismissive of Dr. Fauci as being sort of the leading expert on infectious diseases. Tell us more.
Right. He said that Dr. Fauci shouldn't be the end all when it comes to making the decision if children return back in the fall. He said, let's look at some of the foreign models where countries that did not close down schools don't have, high numbers of mortality among kids. But Dr. Fauci, in the ways that he has done in the briefings, as well as when he's been on the Hill, addressed it by saying, let's not, generalize it. Let's not assume that kids won't have a problem from this, because we just don't know yet. And he really, brought that home. We don't know. Things are still developing in the science world about how this is affecting children. And he wanted to be sure that, no one took away from his comments that children won't be affected.
Yasmin, Fauci was careful to say, I'm not here to give advice about economic things. I give advice about public health. But then he did go on to warn about the safety of children going back to school because of this thing that's happening that's similar to Kawasaki syndrome. And we'll talk more about that with our colleague Lenny Bernstein in a little while on the show. But it was interesting how Fauci pivoted and said there are a lot of unanswered questions about this strange inflammatory syndrome that we are seeing among children. And so we shouldn't be cavalier in assuming that they're immune to this disease. Yasmin?
Yeah, I mean, I think, Senator Rand Paul sort of wanted to downplay the threat to children because they are far less affected than adults and the elderly. But, you've seen these sort of frankly scary cases arising in children. And Dr. Fauci basically warned, look, a lot is still not known about the virus, so we shouldn't make assumptions just based off what we know now. And the other thing, which wasn't addressed as much in the hearing, but has been addressed, by experts, by Dr. Fauci and other forums, is that even if children are at lower risk, if they go to school, they can be carriers of the virus and then spread it in homes with parents or grandparents or, at-risk family members who might have underlying health conditions. Just because children themselves might be at lower risk doesn't mean that they're not, a high risk to the population. They can still be carriers and they can still spread it to people who are high risk. And that's, I think one of the things that not everyone has fully grasped about this virus is some people have a very mild case of it. They think it's not a big deal. Senator Paul talked about how he had coronavirus and he recovered. So it's not that big a deal. And he said it's not that fatal of a disease. It's basically flu for kids. But that's just not the case for everyone. The point of social distancing and mitigation is to, some of us might be healthy and not have a very severe case of the disease. But you see in nursing homes, you see among people with pre-existing conditions. Our colleagues have even reported about young people in their 30s and 40s who end up with strokes or very severe cases of the infection. There's just still a lot that's not known. And I think what Dr. Fauci was trying to stress is it's way too early in our understanding of the disease and the progression of it to make assumptions about how safe or not safe some certain populations will be.
There are also questions about immunity and whether you've had coronavirus means that you would then be immune to it again, Rhonda. Rand Paul sort of pushing at Dr. Fauci on that point, but Dr. Fauci didn't agree with his assessment that, that the assumption is that immunity is likely.
That's right. And Dr. Fauci does this very well, where he doesn't want to do these generalizations. So even though Rand Paul is talking about, potentially that antibodies will be protecting those who have already had it and that he's sharing his own personal experience with it, that may not be the case overall. And I think that that's probably very important for Dr. Fauci as well as the others to make sure that when they're in these public hearings, or, well, the public wasn't there, but public members were viewing it, to make sure that people don't make these sweeping overgeneralizations, because one of the criticism that we're seeing is that when this first started to hit, late February, early March, there was communication that this was only affecting the elderly. So if you were young, healthy, or a child, or even in your 30s, you should probably be okay. And we are, as Yasmin just said, we are seeing cases of people in those groups that weren't deemed as vulnerable experiencing the disease in devastating ways. So I think Dr. Fauci and the others definitely wanted to make sure that they did not leave this hearing with people thinking that, everything's okay now. If you get it, it's not that serious because, Rand Paul or others have said that.
All right. I'm going to let Yasmin Abutaleb go. You've got so much reporting and filing to do, Yasmin. Thank you so much for joining us this afternoon.
Thank you.
Rhonda, before we let you go, tell us more about your experience reporting from Capitol Hill today, because it is just such an unusual and unprecedented moment. How did you get around? How are you following the hearing? Tell us about it.
Yeah, well, as soon as you walk in, you're greeted with security guards who are wearing gloves. They're wearing masks. There are signs and like stamps on the ground that say, please stay 6 feet apart from everyone. So it's certainly physically a different experience. And also just even the logistics of going through the Hill. Libby, you know that there are certain points in some of the buildings that serve as stakeout areas where you can just stand there all day and wait for senators to pass by. Well, that's no longer. We, can't do those, tight groups of being smashed together as reporters and waiting for comments. You certainly shouldn't be near a member of Congress and interviewing them in close proximity. So all that has changed. And there certainly is not the number of media members up there that there used to be. And it's so funny to experience what is a high profile hearing today in a way where no one was there on the ground like I remember when I was there throughout last year. So it definitely, the dynamics there are certainly different than they were before. You also don't have a lot of staffers walking through. Members of Congress were asked to only bring back those who are really essential to their offices, and even they are staying in the office. They're supposed to take staggered lunch breaks so that everybody doesn't crowd the cafeterias at noon. So I think things will probably tighten up before they will loosen any over there.
And of course, a reminder that when Congress is in session physically, that means the Capitol Police need to be there. That means staffers need to be there, cleaners, feeders, everyone who has a job on Capitol Hill. A lot of people have to activate and go to work when that happens. Rhonda Colvin, thank you so much. I look forward to seeing you again soon.
Thank you.
Lenny Bernstein joins us, health and medicine reporter at the Washington Post. Lenny, there was a real focus today at the hearing on this question of vaccines and trying to get some sense of, should we be hopeful that one is coming? Do we have a sense of a timeline? And Dr. Fauci was very careful to give some caveats here. I was fascinated by his answer to Mitt Romney when Mitt Romney was, asking essentially if it was like a long shot, and he said it's definitely not a long shot. It's likely we will have a vaccine. And Fauci gave some interesting reasons why he thinks getting a vaccine is likely, because people have been able to recover from this disease. So what do you know about the process of developing a vaccine?
Dr. Fauci has been very careful to say the same thing over and over again for the last several months, which is 12 to 18 months, if everything falls into place exactly as we hope it falls into place. Well, that doesn't always happen. Some vaccines take several years. We've been trying to develop a vaccine for HIV for 40 years, and we don't have an HIV vaccine. So, different viruses present different difficulties. But we can say that there are over 100 efforts underway right now. Many, if not all of them, compress the normal time frame that we use to develop a vaccine by cutting short some of the trial periods that are normally used when we're developing a vaccine. So 12 to 18 months sounds like as good an estimate as we know right now. There are some who say they're going to do it earlier. There are others that may take longer, but we have a ways to go. So until this happens.
A lot of the focus of this novel coronavirus was that it affects the lungs, right? And we were just so much talk about ventilators and the incredible difficulty some patients had with breathing. But you and your colleagues have been reporting on all the other parts of the body that this virus attacks. What do we know about what in the human body is vulnerable to this novel coronavirus?
When this virus first emerged from China, it was seen as a respiratory virus. The warnings that went out were watch out for pneumonia, watch out for other kinds of difficulty breathing. It attacks the lungs. It's very serious. It puts people in hospitals. It chokes off their breathing. As the pandemic has continued, they are finding the virus in other places. They find a lot of virus in the kidneys. They find that the virus attacks the heart, find that the virus is causing blood clotting. They find the virus in the nervous system. They find the virus attacking the lining of the blood vessels. There's a couple of things that seem to be common traits. Number one, the virus causes an inflammatory response by the body that sometimes goes awry. In other words, it over-responds. The body over-responds, and the actual effort of the body to kill the virus can cause problems. The second thing is that the virus seems to attack these blood vessels and organs where the ACE2 receptor is plentiful. This is the receptor that the virus uses to bind to different cells. And you find a lot of them in the gut, in the kidneys, in the lungs. And this virus attaches there, and it seems to do a particularly thorough job of attacking cells once it gets on there. It's not as lethal as MERS, but it's more infectious. It's the same degree of infection as the other 4 coronaviruses that cause colds, or roughly there. But so you have a combination of those 2 things that seem to make this virus very difficult.
We were talking earlier about how Senator Rand Paul was encouraging schools reopening and saying that we have to look at the mortality rates of children, and that children are not largely dying from this. But I want to read a line from your story that we were just showing the headline of, about how the virus attacks the body. You and your colleague Ariana wrote, "It mostly spares the young until it doesn't." And then you proceeded to report on these frightening cases of children dying. Now, they're rare, but they have happened, where children are having this strange response. And Dr. Fauci himself called it very strange today. What's happening?
It really did seem to spare the young for a number of months. You could walk around and you could hear people say, well, I'm in my 20s, I'm in my 30s. This is not a virus that, even if I got it, is going to kill me. It's killing the elderly. And now, as we get into May, we see this response among children. It's an inflammatory response. They're calling it a syndrome. And there have been about 85 young kids between the ages of, I think, 2 and 15 who have responded in a very strange way. And they're wondering if it's attached to the virus. And so they're coming down with all kinds of strange symptoms that appear to be, again, as a result of the virus's own immune response. So this idea that it spares the young, well, we were able to rely on it before this happened, or maybe before we knew this was actually happening, is no longer something we can rely on. When Senator Paul says we need to send these kids back to school, okay, playing the odds, fewer kids are getting sick, and certainly fewer kids are dying. But do you want to risk that with your child?
We had a question written in from Fred, who wrote in from Santa Clara, Utah, and asked, what are the long-term health impacts to those who survive coronavirus? So as you've been reporting on how the virus can attack different parts of the body, what do we know about the after effects?
The information I have is purely anecdotal because, again, we're in the middle of a brand new virus that nobody's had any experience with except for the past 5 months. I have received letters and emails from people and comments on stories that say, you know, you guys talk about this as a 2 or 3 week or 4 week virus. I'm still feeling the effects of this virus 6 and 7 weeks later. I still feel tired. I still have shortness of breath. Sometimes the symptoms get better and then they get worse again. I'm still unable to work. So I would have to say to this writer, to Fred, we don't know. And it's going to take years and years of research to parse out what might be something else from what this virus is actually doing. But I do see increasing anecdotal evidence as our caseload, heads up towards 1.5 million people, that some people experience the impacts for a much longer period than other people do.
We heard so much of a focus today on testing and comparing the U.S. to South Korea. President Trump has been touting the U.S. testing record, but the testing that's being done, it doesn't come close to what health experts recommend would be necessary to safely reopen the economy. So as a health and medicine reporter, Lenny, what are you watching in terms of testing and contact tracing?
Well, whenever I'm asked this question, what I try to say in response is, what would make you feel comfortable going back into work and sitting in a cubicle in a bunch of desks say arranged 6 in a row with people next to you? Would it be a mask? Would it be dividers? Would it be that we all are tested every day upon arriving? Would it be that they take our temperature? Would it be that we do an antigen test to see which of us has antibodies? All of these things are going to have to be weighed against the risk until we have a vaccine. It's a risk-benefit analysis, every day moving forward, your company and my company and everybody's workplace is going to have to make that call if we're going to reopen our society. Now, the problem with the antibody tests, as has come up many times before, is we don't know if they convey permanent immunity. If I've been exposed to the virus and I have the antibodies in my blood, is that it? I'm good to go? Or does that go away until we have a vaccine? So I think everybody has a different comfort level. I'm in my 60s. If this virus gets me, I may have a very, very difficult course with this virus, as opposed to somebody in their 20s. Anybody with an underlying comorbid condition, diabetes, heart disease, they are going to have to weigh all that. What amount of testing and physical distancing and barriers makes you feel comfortable moving back towards normalcy?
We're getting confusing messages from the White House about people who want tests being able to get tests versus people who need tests being able to get tests. And President Trump, even yesterday, in the course of saying anyone who wants a test can get a test, said, you don't need to get one if you don't have sniffles or a sore throat. So let's put aside sniffles and a sore throat for one moment, and first just focus on this question of needing a test versus wanting a test.
Well, if you want to move back into society, you want a test. You want an antibody test. You want to know whether or not you've been exposed to the virus. Do you have antibodies? Do you have some kind of protection? If you want to know, are you infected today? You want the blood test, the PCR test, that tells you whether or not you are currently infected with the virus. Now, when we had the dramatic shortage of testing, they tried to limit this to people with severe symptoms, because look, if you were asymptomatic, you could go home, you could self-isolate, you could maybe, if you lived alone in particular, keep from spreading the disease to anyone. It didn't really matter whether you got the test or not. Now we're moving into another stage. Clearly, 40 states are reopening. We need to know much more about ourselves in real time. If I don't have symptoms, but I want to go back to work, I need to be tested. I walk in the door, I don't have COVID-19 today. I go home, I walk back in the next day, I don't have COVID-19 that day either. The best example of this, of course, is Katie Miller, the vice president's press secretary. She was negative one day and everything was fine. Nobody was wearing masks. She was positive the next day. Then everybody had to go self-isolate because she may have infected the people that she was around. So testing is important. We have to ramp it up. We need to have many more than we have right now, but we have to do it in a way that the goal of it is to get us back into society and to get us functioning as close to normal as we can.
And President Trump talking about symptoms of a sore throat and sniffles, the idea of doing temperature checks. I mean, Lenny, that's just the tip of the iceberg of what we're talking about in terms of things to watch for and things to be aware of. Taking
our temperature is better than nothing. If you walk in the door to the Washington Post building and you've got 102, they're going to turn you around and get you the heck out of there. Might be you just have the flu. Might be you have COVID-19, but they're going to turn you around and get you out of there. But it's not a great way to check for whether somebody is infected with the virus, because as we know, people go through the whole course asymptomatic, and some people are what we call pre-symptomatic. They have the virus, but they're not yet showing symptoms. They're going to show them, 6 or 7 days from now. So taking your temperature is not a terrific test. So what we need to do is find a way to get people back to work or back to school without just there being that test alone. There has to be ways of figuring this out to get us all back into society.
Lenny, you were a part of a team that reported on this concern that Trump economic advisors have, that unemployment rates could get above 20%, that the job market could get even worse. Our next guest, Heather Long, economics correspondent, can talk more about that as well. But first, Lenny, how are you watching for President Trump's team to balance this question of calling for the economy to reopen and yet recognizing the shortcomings at this point of tests and contact tracing and these other steps that many health experts say are necessary?
Well, It seems that many states are moving too fast. It doesn't seem like a stretch to say that states that have rising caseloads, despite the economic pain, should not be moving forward to reopen at the extent that some of them are, the Georgias, the Texases. What I am watching for as a health reporter is when or whether they have a very sharp rebound. There's a 2 to 3 week lag from infection to when we start to see people come in. And I'm worried that June will show us a rebound, or if not, then down the road into the fall, we're going to have a very severe rebound. That is the concern. Given what we saw in New York, a big rebound of that size or a rebound of a larger size be a very big problem for whichever city has it.
All right, Lenny Bernstein, health and medicine reporter. Thank you so much. I really appreciate your time and good to see you.
Thank you.
Heather, let's turn the conversation to you, and thank you for joining us. I first want to get a read from you of where we're at with the unemployment numbers. Please put them in context for us.
Well, it's pretty horrific. There's hard to know what adjective to use. Terrifying, horrifying. You have to remember there's real people behind these numbers. The official number now is 14.7%. That is the worst since the Great Depression, so since the 1930s. But most people say, including the White House, say the true unemployment rate right now is certainly 20% or higher. And the reason that the official rate wasn't even higher is the way they calculate that is they do this survey where they go and they ask people, are you working right now or not? And due to some technicalities of how they ask the questions, some people said that they were absent from work for other reasons. Or that they were, they had stopped looking for a job altogether. And if you don't actively look for a job for 4 weeks, you're not technically counted in the unemployment rate, that 14.7. So when you put the people back in who probably should have been counted, no question, we're at 20% or higher right now.
And Heather, there is optimism, as we found in polls, of many American workers who do hope they can get their old jobs back when things change. How does that impact how you answer a survey question then?
Yeah, it was fascinating. On Friday, we learned that of the 20.5 million people who lost jobs in April or who weren't working, 18 million of them said they were furloughed, which is usually a temporary layoff. So there's some hope that they would go back to work, possibly this summer, or maybe even later this month as more and more places are opening up across the country. That's a game changer. If you can get people back to work, obviously they keep their health insurance. They know what the environment they're coming back to. They don't have to have an onboarding or go through extensive interview process or learn the new job. It's just so much easier, both financially and just kind of mental health wise and daily life wise, to go back to your old job. Unfortunately, though, some of that optimism might be misplaced. And this is this whole debate about, are we opening up too early? Are we going to see a rebound in cases, which would mean having to shut down parts of the economy again? And what we're starting to see is companies going bankrupt, both big companies like J.Crew that many of us have heard of, as well as a lot of small town places that have been around for decades, local restaurants. Of course, if that company goes out of business, they won't be bringing those workers back. So we're in a race against the clock right now for these workers. Can we get these people back into jobs in probably the next 2 months? I would say if not, once somebody's been out of work for 4 months, the likelihood of them going back really plunges.
We had a lot of questions written into us, Heather, asking about the stimulus checks. Still, people wondering when they're going to get them. So even though we saw a lot of the checks deposited, here's one example. Betty, who wrote in from Pennsylvania, asked what percentage of people have received their stimulus checks. Is the U.S. government still depositing them in personal accounts? So what can you tell Betty and the rest of our audience about what we know on this front?
Yeah, that's a great question. So what we know is about 75% of them have gone out. So that's a lot. That's over 130 million of these payments, most through direct deposit, some through physical checks have arrived so far. But obviously, 25% are still waiting, and that's about 50 million people. So that's a lot of people still waiting. What we're starting to see, the people on Social Security have started to receive their payments, but not everyone has. So May was sort of the month to get the Social Security folks get their $1,200 payment out. So I keep telling people, they'll tell me, my aunt got it or my relative got it, but I haven't. It's the best example I've heard of this is, basically, some people are like in the fast check, the 15 item or less, line at the grocery store, and other people have to wait in the longer line. And unfortunately, it can be really tough if you're in that longer line and having to wait longer for that payment. There's two things to know. I would say hold on till the end of the month. I wouldn't panic yet if you haven't gotten it. And the second thing is you have until tomorrow to try to fight that website, that Get My Payment website, to enter your direct deposit information. So if you haven't done that by tomorrow, you will get a check in the mail.
All right, I'll show you one more question from Sue, who was asking about just the thing you're talking about. She says she lives on Social Security, so she doesn't file taxes. And she says she has direct deposit, but hasn't seen anything yet. So for Sue in Chicago, even if you have direct deposit and you're on Social Security, it still might not be there yet?
That's correct. Yep, this is not unusual. We've certainly heard from a number of people in this circumstance, both on regular Social Security or on SSDI, the Social Security disability payments that also come out monthly. Again, they just can't send them all out at once. What's harder to know for Sue is, will Sue get the direct deposit or will she get the paper check? Unfortunately, there really isn't good information to know whether or not she'll get one method or another, or to understand why she wouldn't get the direct deposit.
Heather, we're seeing House Democrats push for another one of these stimulus bills. They're calling it CARES 2. We're talking about another $3 trillion looking to help states and others. It does raise the question of just where the money is coming from to pay for all of this. One of our viewers asked that. Edward wrote in from Fredericksburg, Virginia. How long will it take? How much will it eventually cost to pay back the recent stimulus package? And Edward wants to know if his grandchildren will be stuck paying the bill. Now, we don't know how old Edward is, so hard to know just how long this may go into the future. But what can you tell us about the number crunching that's been done on the debt that's generated by these bills?
Well, unfortunately, Edward is right that our children and grandchildren will be paying off this debt that we've accumulated, both from this coronavirus and pandemic response, as well as from the recent tax bill, as well as from the wars in Iraq and Afghanistan. As a country, we've been on a spending spree the last 20 years. And that said, it's important to remember that almost all economists across the political spectrum say that the government spending right now is necessary. The worst thing that could happen right now is that if we don't spend this money and all these people remain unemployed and all these businesses do shut down, we will be in another Great Depression. Right now, we're in a deep recession, but we want it to be short-lived. We want it to be over by the end of the year or early next year. And then, but if we don't spend this money, we don't do relief, we could be in this for years, maybe even a decade, like what happened in the 30s. That is not what anybody wants, and that would probably add more to our debt longer term. So there's a trade-off here. In terms of where we are sitting today, the Treasury Department just released the April figures at 2 p.m. today. It showed that April was the worst deficit on record. So already this year, we have 1.5 trillion deficit. So we haven't been above $1 trillion since the Great Recession, and we're already there. We still have months more to go in this fiscal year. So we knew it was going to be bad. It's definitely adding up. And in terms of where we go from here, there is almost no doubt that there will be another stimulus or relief package, whatever you want to call it. Whether that number is 2 trillion, 3 trillion, remains to be seen and will be debated, but it is necessary, it will be needed, and I expect it in the next month or so.
We saw a lot of bipartisan unity to get prior stimulus bills passed during during this coronavirus crisis. But here's a headline on a story you and some colleagues just filed a couple days ago. Confronted with a horrendous jobs report, the White House and congressional Democrats aren't even talking. So a divide just a few days ago between President Trump's White House and House Democrats.
Yeah, I think it's really interesting how President Trump has shifted his tone in the last 3 weeks. You know, if you listen to Trump 3 weeks ago when he would get asked by reporters, are you open to doing another stimulus check? This is a very popular program. And he would sort of say things like, yeah, I'm open to it, maybe, in his Trump way, sort of keeping the door open. And about 2 weeks ago, he really changed his tune. He really began to say, no, we need to reopen the economy. We need to prioritize that. And then the last several days, he and his colleagues have made it clear, they've used these lines, we need to wait and see what happens with the money already spent. We've doled out a lot of money, $3 trillion. Let's let that play out before we do anything else. Or these comments like, I don't want to bail out the blue states or the liberal cities that have spent too much over the years. So he's really dug in a way that actually surprises me. You would think that running for re-election as president 6 months away and with unemployment at Great Depression levels, it surprises me that he wouldn't want to do another round of stimulus checks. Those were very popular. They're clearly helping people. I've spoken to many people. This has been the difference between whether they're eating or not. This has been the difference whether they're keeping their apartment or keeping their mortgage payment going. But for some reason, a number of his advisors and the business people he calls a lot have just really hammered this message into him that we need to be more cautious about spending more right now.
What are you hearing, Heather, from business owners who've sought the loans, essentially grants, if they can pay out their loan on payroll? What are you hearing from business owners about their success in getting access to them, frustrations they have or concerns they have about having to pay it back?
That's a great question. The Small Business Administration likes to remind people that over 4 million businesses have received one of these loans. So, that's a pretty big number. However, there are 30 million businesses in small businesses in the United States. So it's really a drop in the bucket. And the number one complaint, especially from restaurants, we all know small restaurants in our neighborhoods that are hurting, that might have to close. And the biggest issue is if you're a small business, particularly think about it, you only have 10 employees or 20 employees or less. Usually your bigger costs actually aren't payroll, it's your rent. It's those overhead costs, maybe the insurance, the rent, the utilities. If you're a restaurant, you got to buy all that food, which most of it went bad when you closed in March. So you got to buy a whole new inventory. And the problem is, in order for this PPP loan to become forgiven, which is what most small businesses need, they need a grant, not a loan. You have to spend 75% of the money on employees. Well, if half of your costs are coming from overhead, not employees, the math just doesn't add up. And so there's been a huge push, U.S. Chamber of Commerce, various small business lobbies, certainly the restaurant industry, to lobby Congress and lobby the White House right now to say, look, can we alter the terms of these loans, or can we do a third round that has different terms to really help these truly small, what we call micro businesses?
You've been telling the stories of Americans who the coronavirus has caused them to slip from the middle class or the working class into poverty, people who are now living in their cars, people who are just trying to figure out how to feed themselves and their families. Heather, what are you hearing from them about what the coronavirus has revealed about the nation's class system?
It's very clear in the last few days that the economic impacts and fallout from the pandemic are hitting hardest Hispanics, African Americans, Americans without college degrees, many of whom can't work from home in their jobs, and especially low-wage workers in the retail industry and the hospitality, who work at hotels and who work at places like this. These workers, they were making $15 an hour or less. They didn't have savings, or they had very little. And unfortunately, we knew We knew a year ago that 40% of Americans were living more or less paycheck to paycheck. And unfortunately, the reality of what we are seeing right now is what happens when those paychecks stop. I've seen some heartbreaking conversations. Spoke to a woman in Florida last week who used to work at a very nice spa on the Florida Panhandle. She's been out of a job. She just put her home up for sale. Even though she has been able to get a little bit of help, the reality is she doesn't think that resort will be anywhere near, back at full capacity for a year, and she can't survive, for months and months to come on a reduced or no paycheck.
So Heather, what are you going to be watching over the next couple of days and the next week or so? Are there new numbers coming out that you'll be paying close attention to? Will you be watching to hear if the hearing today, the Senate hearing today in the Health, Education, Labor, and Pensions Committee moved the bar anymore, moved expectations anymore on testing and contact tracing, which could then help states figure out a viable reopening plan? What's on your radar?
I think the number one thing on my radar is trying to watch to see how many small businesses are closing forever, how many are choosing bankruptcy or to permanently shut their doors, because that is the long-lasting scarring that will have ramifications for years and years to come. The other thing that a lot of people don't watch, and we're also focused on Congress and President Trump, but the Federal Reserve is actually, I hate to use the word doling out, but certainly distributing even more money than Congress and the White House are right now. The Fed has already pumped over $2.5 trillion into the economy. And so this week, for the first time ever, they are now buying corporate debt, and they are soon to start buying the debt of cities and states. And how they execute that is really going to determine who the winners and losers are coming out of this pandemic. So I'd say keep an eye on the Federal Reserve. They've got the biggest bazookas of all right now.
Well, I'll be watching your reporting so you can help me understand what's happening at the Federal Reserve, Heather. So thank you for covering all of this and following all of this. It's great to talk with you. Heather Long, economics reporter. Thanks so much.
Thank you.
Thank you for joining us for this special report from the Washington Post, covering the latest news from the novel coronavirus. We'll be back on Thursday at 3 o'clock Eastern time, and we'll have some very special guests, some of my colleagues who've been reporting from the front lines, whether they've been riding on airplanes or visiting hospitals or talking to small business owners. I'll be getting to speak with some of them as they do their reporting, and they can share with us the stories that they're hearing from Americans around the country. So do tune in Thursday afternoon. I'm Libby Casey. Thank you for watching. Please be healthy and be well.